I just want to welcome everyone here for our 2021 webinar series, and we are so excited to kick it off today with such an important topic, and that is physical activity in children with juvenile arthritis and other rheumatic diseases. Next slide. So for everyone who is new to Cassie and Friends and who didn't join us for our webinars last year, I just wanted to let you know a little bit about who we are. So Cassie and Friends is a community of youth, parents, siblings, family members, and all of their healthcare teams and other medical professionals in pediatric rheumatology across Canada. And we work together every day on behalf of kids and families living with juvenile arthritis, as well as other rheumatic diseases like lupus, vasculitis, fever syndromes. And together we work on all the ways we can transform kids and families' lives through research, connection, education, and support. If we go to the next slide, I just want to say that we have so many amazing programs, resources, and services that our team is so proud to provide to this community. And as we work to ensure kids and families can thrive every day with the challenges of rheumatic diseases, we also never lose sight of our ultimate goal, which is a pain-free future for all kids. Next slide, please. So at this time, we are really starting off 2021 with a bang, and we have over 100 people registered for this session today. And I wanted to take a quick second to introduce you to one another and encourage you in your chat function. So if you look down at the bottom of your screen, you'll see a little icon that says chat. Take a second, introduce yourself, let people know where in Canada you are. You can see we have 47 cities as well as an international audience. Maybe give a few notes about your own child, their age, and maybe you could also include a way that you got active this weekend. It's Saturday night for most of you, so we all should have done something active by now, and if you haven't, by the end of this webinar, we'll all be raring to go for Sunday. Next slide, please. So as I mentioned, this is part of a virtual education series that Cassie and Friends has been committed to delivering. It was launched in March 2020, especially with the challenges of COVID and having in-person events. We were really excited to bring the education that Cassie and Friends has always delivered into a virtual platform. What this has resulted in is a pretty amazing archive of past webinar recordings, as well as the Q&As from those sessions. So whether that be questions from parents or youth, they're all archived on our website where you can access them anytime. We also have two pretty amazing webinars coming up after this one. In February 27th, we have a nutrition webinar with a dietitian, registered dietitian from Sick Kids. And then in March, we have a really important session on Methotrexate, which will be led by a pediatric rheumatologist from BC Children's Hospital. Next slide, please. I also would be totally remiss not to mention Team Cassie and Friends, and I'm wearing my shirt here today. Team Cassie and Friends is not only our biggest fundraiser of the year and the way that we're able to make these kinds of programs possible, but it's also such an amazing way to get active with your family. I looked through the attendee list here, and I have actually had the pleasure of running or getting active alongside many of your kids and families. And I really encourage everyone to get involved. We have run teams based out of Vancouver, Calgary, Toronto, as well as Hamilton, Ontario through the Around the Bay run. But we also have an amazing virtual platform where you can participate from anywhere and really help get behind our vision of a pain-free future for kids. Next slide, please. Also, so you're meeting people in the chat function now, and one of the pillars of Cassie and Friends is connection. And we know that, whether it be early in your disease diagnosis or any time when you're changing medication or dealing with even just questions around whether that be great soccer cleats and getting active or the transition of high school, talking to other families who understand can make such a difference. So we have a brand new online secure platform for parents, which you can join at cassieandfriends.ca/support network, and you can meet others, ask questions, connect into our medical advisory committee, as well as access some really great resources like a pain and activity tracker and a medication tracker as well. Next slide, please. Lastly, I want to really give a huge thanks to our series sponsor. Nicola Welf has been an amazing partner to us, as well as support from AbbVie, Amgen, Roche, and Sobi. Next slide, please. So a really, really amazing part of these sessions, and I think one of the biggest points of feedback we've had is just the opportunity to ask questions. So we encourage you to use the Q&A box below. So not the chat function, but there's another button that says Q&A. And you can enter during the session, or we will have a live session at the end of the presentation where everyone will come back on the screen and you can ask questions of any of our speakers, or even just share a little bit of your story as well. I actually had a couple other housekeeping notes. Just wanted to reassure everyone that your mics are muted during the session. And again, if you decide you want to flip into the French presentation, that's available for you as well. Next slide, please. Okay, so now we will, without further delay, get started. And I have the pleasure of introducing our first speaker, Mackenzie Riddell. Mackenzie is 14 years old, and she is already an accomplished high-level synchronized swimmer, despite facing some unique challenges from being diagnosed with juvenile idiopathic arthritis at the age of 3. She currently goes to Cochrane High School in Alberta, and one really cool thing I read about Mackenzie was that she hasn't let the pool closures caused by COVID deter her at all from staying active, and has used the opportunity to try new sports like wake surfing in the last year. And with that, I'm really excited to introduce Mackenzie, and I will turn it over to you. You are unmuted and you can get started, Mackenzie.
Hi, I'm Mackenzie. Thank you very much for that introduction. Yeah, so I have had arthritis since I was about 3. I have arthritis in both my knees, both my ankles, and the top of my right foot. Yeah, so I am a synchronized swimmer. I swim for the Calgary Sea Sprites. I've competed all throughout Alberta and stuff, and yeah. So some everyday activities that I do though, because not everybody's into sports that way, but it's important to stay active through everyday activities. So some everyday activities I do are runs. I go for walks with my dog sometimes. I just do little workouts. I do some stretching because I have to be flexible for synchronized swimming, but you can just regularly stretch as well. And then gym class is probably the most regular thing that you can do, really. Yeah, and so I wanted to say that it's really important to take a break when you need it. Like, you know your body the best. You know your pain levels more than anybody else. You know when it hurts and you know when it doesn't. So by knowing that, you need to just be able to fully understand exactly what's happening with your body at the exact moment in time. And when you need to take a break, you just tell whoever you're with, or if you're just by yourself, then you just take that break or however long you need until you start to feel better. A way though to avoid taking breaks is to remember taking your medicines. I'm on naproxen, and then I used to be on prednisone, but that didn't really work for me, and different things work for different people, and that's perfectly fine. So just remember to take your medicines. And then I also get injections whenever I have a flare-up, and those really seem to help me, but again, it's different for every person. Yeah, so it's just really important to remember to take your medicines and to do the stretches that your physiotherapist give you, sorry. Like I don't always like the stretches I get but I remember that it's important to take them, and sometimes it hurts to do them, and sometimes it's okay to do them, but it's just so important to take your medicines and to do your stretches and whatever else your doctors tell you, because your doctors are just trying to help you, and you don't owe it to them, but like it's important that you do it because they're trying to help you, so you might as well put in that effort the same way that they are. Sorry, my dog's barking. um like I said earlier, you know your body better than anybody else, so it's just really important that you have that boundary with yourself, because other kids won't have that, and if you push yourself, it might just get worse. I know from experience, I've sometimes pushed through the pain, or I've just tried to ignore it or push it aside, and that just ends up making things 10 times worse. Because then you're just avoiding the pain, even though you should be dealing with the pain so that you can get better later on. So I was asked to talk about how to tell different types of people. So I'm going to start by mentioning how I told my friends that I have arthritis. And how I like, and when I'm doing activities with them, I'll say, okay, I need to stop if I do. So with my friends, I find it's almost better not to make it like a joke, but friends are there to support you, and they're not going to judge you for having arthritis. So how I described it to my friends is, like, I joke around a little about it. I'm like, if I need to stop, I'll just be like, oh yeah, I have old people knees or something like that. Just so that they're not worried, because my friends tend to worry about me, and I think I don't want them to worry. So I make it not a joke again, but like I just try to bring some humor in so that they don't get so scared, because it is a scary thing hearing that a 14-year-old or however old you are has arthritis. It's well, it is common, but not a lot of people think it is common. So telling my friends, I just try to make it not funny again, but like just not so serious with them, because they're not going to judge me, and I understand that and I know that. So I just, yeah, like if my friend's like, oh, are you okay with your knees? And I'll be like, yeah, they just are kind of sore, just like an old person or whatever. Just make it a funny thing. And then telling your coaches and your gym teachers and any person who's that type of figure in your life is definitely more awkward. Um, I feel like coaches also understand you a little more. Like when I told my coach that I had arthritis, I've been swimming with the same coach since I was like 7 or something. So she's been very good about it, but I know some people switch coaches or get new coaches, but it's just really important to set those boundaries and say, I have arthritis and I need to stop, or if I'm having a flare up, I can't come to practice and I'm sorry, but you need to make sure that you put your health and your body before your activities. Sometimes I don't want to. Sometimes I'll want to just get to practice and I'll just want to push through the pain. But it is so important that you set those boundaries with those people so that they understand exactly what is your condition and when you need to stop, how you need to stop, how long you need to stop. So what's something they can do to make it easier on you? And then gym teachers, this one's common for every kid in grade school. Um, Gym teachers is definitely a more awkward conversation because your peers are all around you and they don't really understand that well. And gym teachers see like hundreds of kids, and it's like maybe 2 in every 100 kids will have like arthritis. So they don't fully understand, I don't think. So again, it's just about setting those boundaries and saying, I need to stop when I need to stop because it's arthritis and it's a serious thing. Yeah, like I have had new gym teachers pretty frequently lately because I've been switching schools or just like moving up in grades. And so it's very awkward, and I hate doing gym teachers. I hate having that conversation with gym teachers the most. And sometimes it's easier to just get a doctor's note instead of having to set that conversation. So something that I've done in the past is I have gotten one of my doctors, to write me a note saying that when Mackenzie needs to stop because of arthritis, you have to let her. And then I just give that to my gym teacher and I explain a little bit, but I don't go too into depth about it because they'll just see the note. Yeah, so it's also really important to remember, like, you gotta listen to your doctors because they know what's best and it's their profession. Like they know exactly what to do and what's going on, right? So like one time I had injections a couple days before I was supposed to have a competition, and I was so mad. I did not want to get my injections. I just wanted to compete. I was not having it. I was like, no, I have to be able to compete this weekend. I can't, because synchronized swimming competitions are from Friday to Sunday. They're a whole weekend thing. So I got my injections on the Tuesday, or I think, and then and usually you're supposed to go easy for a whole week. But I talked to my doctors about it and they said, if you don't do any activity for the 2 days and then the Friday you ease into it, then you can compete. And I didn't want to, because usually Thursdays are the days that we do run through all of our routines. So I wanted to just get in that pool on Thursday and I wanted to train like everybody else, but I knew that I couldn't because I had to listen to the doctor so that by the time the weekend came, I could perform at my best level so that I wasn't in pain or that I wasn't below my normal activity level. So it's just super important to remember all those things. And especially to listen to your doctors and take your meds and do your stretches. And you have to know your body and you have to understand that when it hurts because of the arthritis that you need to stop or take a break. So yeah, because one time I had a doctor and I was supposed to go see a special doctor. I can't remember for exactly what, but my physiotherapist actually came with us because I love my physiotherapist. She's great. So I was at this doctor and he was saying, you can either take a break or you just have to stop swimming completely. And I was like, maybe I'll just take a break because I didn't want to give up that part of my life. It's so important to me. And I hope that you guys understand that living with arthritis doesn't mean that you can't do a sport or that you can't be active, because it's like the opposite of that. Living with arthritis means that you should be doing those things because it's not like it's going to kill you to do them, and it's important that you stay active because if you don't, then you'll just get all stiff. And when you're stiff, it's important that you stretch those out using those stretches your doctors give you, and a whole bunch of stuff like that. It's important to remember though that arthritis is a part of your life and it's with you, but it should not be your whole life. You know, like, yes, take your medicine, make sure you do your stretches, but also make sure there's time in your life to do things you enjoy. Like if you like going to the mall with your friends, or you like to swim like me, or you like to play hockey or do track and field or soccer or anything, or badminton, just make sure that you don't let the arthritis stop you from that, because if you let the arthritis stop you, then it wins. And you do not want it to win because you're stronger than it, and you have to remember that. So yeah, that's most of the stuff I wanted to talk about. Yeah. Thank you very much for listening.
Thank you so much, Mackenzie. I feel like I usually have so much to add when I come back on, but I think you said everything. I found myself nodding the whole way through. And actually, I thought you were the physiotherapist for a few minutes. And I know you have a special relationship with your physiotherapist, who we'll be hearing from next. But yeah, thank you so much. I think everything you said about just like working out what's right for you and listening to your doctor is such a good reminder. But that was just amazing and so inspiring. And you are 14 years old, so I just can't wait to see what's next for you. So with that, I am very excited to introduce our next speakers. And I think our slides are going to pop back up, or they might be being shown. But our next speakers, there we are. I'm very excited to introduce two really special members of the Cassie and Friends community. So Dr. Tommy Gerschman and Julia Brooks will be co-presenting. And Tommy Gerschman is a pediatric rheumatologist. He currently has a community practice in North Vancouver, BC, and also participates in outreach clinics in Surrey with the pediatric rheumatology team at BC Children's Hospital. Previous to that, Dr. Gerschman was a pediatric rheumatologist at Alberta Children's Hospital for 6 years. Tommy has been involved with Cassie and Friends also for many years, where he's provided expert content as well as spoken at our past family days. Tommy has a degree in sports medicine, exercise and health from the University College in London. And when he was at Alberta Children's Hospital, he actually developed a unique multidisciplinary clinic for children with JIA who are athletes like Mackenzie, really to explore the unique challenges that they face. And it was at Alberta Children's Hospital that Dr. Gerschman also worked with our next speaker, which is Julia Brooks. Julia is a physiotherapist at Alberta Children's Hospital in Calgary. She's been working specifically with the pediatric rheumatology population for the last 14 years. And Julia said she just loves working with kids with arthritis and finding all the ways that she can help them, whether that be return to the things they love or find the things they love, with an overall motto of encouraging activity for life. And as you can see from her photo there, Julia also loves the outdoors and being active with her own two little ones. And with that, I am really pleased to hand it over to Dr. Gerschman and Julia Brooks.
Thanks so much, Jennifer. D+. That is the report card score that Participation gave children in Canada in terms of meeting physical activity recommendations. D+. That's a score of about 35% for those who don't remember what the letters convert to. And as you may have guessed, children with JIA score even worse. We have learned that children with JIA are active for less time and for fewer days per week compared to other children. But I ask you this, does it have to be like that? We are here today to talk to you about physical activity and sports participation for children with rheumatic disease. Now I'm going to make a bold statement. I believe that together we can help children with rheumatic disease score higher than the general public in future report cards on physical activity. Let me say that again. I believe that together we can help children with rheumatic disease score higher than the general public. Next slide. Over the next 25 minutes or so, we are going to give you 3 big reasons why we believe this is possible. First, they can. I will go over with you what we know about the capabilities of children with rheumatic disease and some of the risks to still be aware of. Second, they should. Julia is going to review with you the importance of physical activity. We all know that exercise is good for you, but we will highlight the added importance for children with rheumatic disease. And third, they do. Children with rheumatic disease are already doing a tremendous amount of physical activity in sports. In many cases, they are excelling beyond their peers. And we will share with you some of these stories so we can celebrate these successes together and inspire and support our children with rheumatic disease to stay active. Other times, for those who are struggling, we have to join to support in applauding their best efforts and recognize the positive benefits of any physical activity. So remember this, they can, they should, and they do. Now, as a brief aside, as we move forward with this talk, we'll be mentioning JIA a lot, and that's because this is the population of kids who have been the most studied. But most of these concepts can be generally applied to children with any rheumatic disease. Next slide. I want to tell you a story about a patient of mine who came to me at about 15 years of age, asking me if she could play rugby. She said, "I want to play rugby, but my mom says I can't because I have arthritis. Is that true?" So I think there's an important question in there. and one that I know many of you are thinking of or have thought about in the past, and that is, can my child with a JIA exercise or play sports, and can they do it safely? And the bottom line is yes, they can exercise and play all sorts of sports. We used to say that they should stick to sports like swimming and non-contact sports. But these days, we know that children with arthritis play a lot more sports than that, and they do so just as safely as other children. But let's look at some of the specific issues and challenges that children with arthritis might come across. Next slide. First of all, activity in general will not cause a flare of the arthritis if the child is in remission. Unfortunately, these days, we try to get everybody into remission. That's not always the case though. So if there is a flare in a joint, we usually ask that you proceed with caution and maybe avoid things like high impact activities. And the reason is because when a joint is inflamed, it tends to be more sensitive and probably more susceptible to things like pain, but also because the muscles around that inflamed joint aren't going to be as strong or function as well, maybe not have as good balance. And so they're at risk for having other types of injuries. They might step funny or land funny and hurt themselves in other ways. But arthritis can leave other limitations as well. So even after you've had a flare of arthritis, sometimes those joints are not as strong as they used to be, or they might have limitations in the range of motion. They can't bend all the way or straighten all the way. And one of the reasons why it's so important to do your physio exercises is to try to optimize that as best as possible. Next slide, please. I want to talk also about some of the limitations that we've learned about in children with JIA. Overall, it seems that they do have a decreased amount of overall fitness compared to the general population, but also compared to other kids with chronic disease, such as type 1 diabetes. They also have decreased muscle strength, both in the joints that have been affected with arthritis, but also sometimes in other joints as well. There can also be a decrease in the bone mineral density, which can be a marker of increased fracture risk of the bones. Now, interestingly, these are all things, fitness, muscle strength, bone health, that can be improved with exercise and physical activity. So we have to ask ourselves, are these things just part of the disease that we have to accept? Or are they things that we can also work on to overcome and work harder to sort of compensate for? Next slide, please. I think one of the biggest challenges, though, is the psychological impact that a chronic disease like arthritis might have. And so it's important to emphasize and recognize that motivation and belief in themselves can be a big inhibitor for children with arthritis to participate in exercise and sports. Children have told me that sometimes they don't think they're going to be good enough to participate in sports, or that they are afraid that they will let their team down because of their arthritis. And I think we have to acknowledge these concerns and talk to them about that. We also have to acknowledge that sometimes there's fears about what will happen if they do an activity. Are they going to have increased pain? Are they going to have an injury? So we have to talk to them about those sorts of things. There can also be an impact in terms of what the parents believe. And so I think we have to encourage parents of children with arthritis to believe in their children, that they can excel and participate in activities and sports that they might be passionate about. Similarly, as we heard Mackenzie describe, we need to be able to talk to coaches and teammates to ensure that they believe in their teammates, that even if you have arthritis, you might be the star on the team or just an excellent contributor to the team. And finally, most importantly, it's that children with arthritis need to believe in themselves. I mean, we often do talk about and think in terms of being the best. And I think that it's important to say that that's certainly possible. But there are also times where we have to recognize that there are certain limitations. And at those times, we need to reframe the conversation about the importance of being part of something, doing something you're passionate about, and generally trying to have fun with it. So we need to emphasize that they can participate in exercise and sports. Next slide. I want to highlight some of the known risks. So if a child has neck arthritis, and that's something that if you're concerned about, you can talk to your pediatric rheumatologist about, who would usually order an x-ray to see if there's any instability in the neck or anything like that. But if this was something that was found, then we do ask those children to avoid contact sports. Similarly, if there's been involvement of arthritis in the jaw or the TMJ, we ask those children to think about wearing mouth guards when possible in their sports. And finally, if there has been any uveitis, or of course we know that children with JIA have a risk for uveitis, we need to be extra careful about protecting the eyes. And so sometimes in some sports, there's optional eye protection to wear, and I would highly recommend wearing that sort of thing. Now back to our story with the girl who wanted to play rugby. Now she never had any neck involvement, jaw involvement, or uveitis. So from an arthritis point of view, there was really no reason for her not to play rugby. Now, admittedly, rugby is a pretty rough and tumble sport. So I can imagine her mom still might have some concerns, but arthritis shouldn't necessarily be one of them. So I've highlighted how children with JIA can play all sorts of sports. I'm going to turn it over to Julia now, who will talk about why physical activity is so important, particularly for children with JIA.
Thank you, Tommy. I just want to acknowledge that I'm on the traditional territories of the people of Treaty 7 and of the Northwest Métis and Métis of Region 3 before I get started. Hello and bonjour to everybody. So my first slide here just talks about what Tommy had brought up in his introduction, looking at what the general recommendations are for kids in Canada. So the general recommendation is 60 minutes per day of moderate to vigorous activity. And 3 times per week, this should include some sort of weight-bearing resisted type exercise. As Tommy mentioned, unfortunately in Canada, only 35% of our general population is actually achieving this goal, which is a D+. It's a little bit sad, so we have some work to do. There's a variety of different studies out there about juvenile arthritis, and some of the studies indicate that we're meeting, or kids with JIA are meeting as low as 4% of that or as low as 4% of kids are meeting that recommendation. So as Tommy mentioned, we have some work to do, and we can certainly try to exceed even the general population. One cool tool that I like that families can look at is something called the 24-hour guidelines. And this is something that was developed by the Canadian government. And it basically is a graphic with different bars on it. And it talks about how if you break down a 24-hour day, what it should look like. So it includes sleep, activity, light activity, and sedentary time. And it's kind of a nice way to just have a quick one glance to say, does my graph look like this? Or is my graph a little bit more like this? Certainly during COVID time, the sedentary time seems to be creeping up. So it's something that we do need to keep in mind. Next slide, please. So most people have some sense of the risks of inactivity, and I think we just wanted to highlight a few that particularly are important for people with JA and other rheumatic conditions. Obesity is listed here first. I don't typically like to focus on weight specifically in my clinic. I prefer to focus on activity and a healthy diet. However, we do know that there's an obesity and overweight crisis in most of the developed countries in the world. And we also know that obesity and overweight can lead to an increased risk of osteoarthritis. We particularly don't want in our JA population to have increased stress on their joints and have this potentially added diagnosis of osteoarthritis as they get older. So one thing to keep in mind is to stay active and eat well to try to keep a healthy weight. Muscle strength is actually a really important topic. And as Tommy mentioned, often kids that are in a flare, the muscles will be inhibited and won't fire as hard. And also we tend to do a bit of less activity when we're in a flare. And so the muscles can generally get weaker. It's very important for pain management and also for function to have good, strong muscles. We know that the stronger kids are around their joint, the safer the joint is, and often the less pain there is. So that's a really important aspect to consider. In addition, we talked briefly about bone density, and we know that we typically build bone density, or we do build bone density from when we're young up into our early adulthood, and then we really don't lay down any new bones. So it's really important to get those weight-bearing activities. And sometimes that can be a challenge in kids with juvenile arthritis. Heart and lung health is always important. What I like to talk to my patients about is the idea that if you have an underlying chronic condition, it's extra important to try and keep the rest of your body as healthy as we possibly can. And that would include heart and lung health. And we know that for longevity, those are really important organs to keep healthy. And the best way that we can do that is with regular activity. And the final point on this slide is referring back to what Tommy was discussing, the idea of mental health and how important that is. And this is a piece that sometimes gets forgotten, but we know that activity improves mental health. We also know that in kids with chronic conditions that there is a higher rate of depression and anxiety. And so it is extra important to try and get the benefits of physical activity related to mental health. Next slide, please. So this is my favorite slide. As Jennifer said at the beginning, activity for life is a bit of my slogan. So I think it's really important to remember that activity does not mean sport. Activity means moving our bodies. And a lot of people get sort of caught up on this idea that we have to do sport to be active. And many kids, even kids without arthritis, really struggle with the idea of having a sport, of playing a sport. Many kids don't like it, even with or without arthritis. So I like to focus on the idea of trying to be active for life. I have many elite athletes that focus very specifically on one sport for their whole life, and then they may drop out of that sport, or they go to university, or they lose it, and then they really don't know how to be active outside of that. And as Mackenzie had mentioned, she tries to bring in other forms of activity that are on a regular daily basis, not just her synchronized swimming. So I think that's a really important thing to think about, is developing these good habits for life and learning how to be active throughout the spectrum. One other thing to really remember is that anything is better than nothing. So 5 minutes of activity is going to be better than 5 minutes of sitting down. And I think that sometimes that 60-minute number can be exceedingly overwhelming, especially for kids that are struggling with joint pain. That can be really difficult to wrap your head around. But most of us can find 5 minutes of time in our day. Most kids, even if they have pain, can find 5 minutes of time, or be able to manage 5 minutes of time, even if it's with breaks. And I think that it's really important to consider this, because that's a really good way to develop a habit. Start with 5 minutes per day. Try that for a couple of weeks. Then you go, okay, great, I found the 5 minutes. Can I find 5 more? And slowly, slowly, slowly working on adding that habit into your life and finding that time. And that's always going to be better than sitting down. One other little piece here is this idea of physical literacy. So physical literacy relates to a person's ability to perform movements that will allow them to participate in activity. So those things might be things like kicking or throwing. They might be things like hopping or skipping or jumping. And all of these are really important to be able to participate with other kids their age, and even into adulthood. I still hop and skip and jump because I like to. A lot of kids that are diagnosed very young with arthritis either miss these milestones or are delayed in them. And that's one really big focus of my practice, is to make sure that I've caught all my kids up with their milestones so that they can participate as other kids can. Next slide, please. So that's sort of why we should be active. And moving on to why, or do they do component. So just briefly before I turn it back to Tommy, we've already heard from Mackenzie, and she really downplayed her fantastic accomplishments in synchronized swimming. She is phenomenal. I've also had the pleasure of working with a hockey player who's gone on to the junior level with a really severe elbow arthritis, and he was still able to compete at a very, very high level. And I also have a really wonderful powerlifter that I work with who's at a provincial level, and I like to call her a beast, and she takes that as a compliment, so don't worry. And she is absolutely a phenomenal athlete as well. So they are doing it. We can do this. So I'm going to turn it back to Tommy.
Thanks, Julia. We can go to, yeah, perfect. So, you know, as was mentioned off the top there, Julia and I had the pleasure of working together in Calgary a few years back. And while there, we had a clinic together that we developed that was specifically working with children with JIA and who were athletes. And I wanted to share a little bit of our experiences with that group of kids. Now, most of those kids were involved with sport. And I think that the interesting thing was it was a huge range of sports and dance. And so, you know, we often think of sort of the big ones, hockey, basketball, soccer maybe, but there are so many different sports that kids can become passionate about and involved in. And I think that the benefit of being part of a sport or an organized sport is it does seem to increase overall that commitment to physical activity and increase the number of hours that are done throughout the week. It's not necessarily for everyone, and as Julia said, you know, for a lot of people, it's not interesting to be part of an organized sport, and that's okay. Just being physically active in other ways, you know, certainly is extremely important and valuable as well. But we're going to talk about these kids who were part of a sport, and so we can go to the next slide. One of the things that we looked at when we talked with these children were about a few different measures and tried to compare them to what we would maybe expect to find in a sort of a general healthy population, and that's the green dashed line. And we also wanted to compare what sort of your average typical kid with JIA sort of scored on a few different measures. And these were all teenagers. It was about 30 kids. So as you might expect with 30 kids who are involved with sport already, their number of active hours was higher than the general population, and certainly a lot higher than the children with JIA. One of the things we've heard a lot about is pain, and I think that's one of the things that holds a lot of people back is fear of pain and sometimes actual pain that's associated with activity. In the group that we worked with, we found that although those kids had pain, it wasn't necessarily more than what we would tend to see in sort of your average JIA population. And so that was somewhat reassuring to us as well. And again, you know, individual experiences may certainly differ from that, but that was sort of the average that we got. When we looked at other things like physical function and psychosocial function, we found that in general, these kids who were involved with sports seemed to do a little bit better than sort of your average teenager with JIA, but still struggled when we compared them to the general population. Next slide. With kids who are involved with sports and activities, often we do come up against the question of, is this ache, pain, swelling, and so on due to arthritis, or is it from a sports injury? And I think that can be really tough and tricky to answer at times. And so it's important to have this team around you. And as Mackenzie said, you know, to come talk to your pediatric rheumatologist, which most children with JIA across Canada will have, and they can help answer some of that. And for a lot of kids, but not necessarily everyone across Canada, they'll also have access to a pediatric rheumatology physiotherapist who can help with that. And Julia is going to talk a little bit later about the value of especially for those who don't have access to pediatric rheumatology physio, is to find a physio in the community that maybe has worked with kids and kids who've played sports, who can then communicate back with the pediatric rheumatologist. Next slide. When I think about the impact that growing kids have in terms of the different issues that they come across, we have to keep in mind that kids are growing and developing. And of course, the same goes for kids who have JIA. And so their bones are not as strong as adult bones. They're still maturing. And that makes them susceptible to certain overuse injuries. When you're playing a sport throughout the whole year, certainly those repetitive movements can sometimes potentially increase the risk of those overuse injuries. And that goes for kids with JIA or without. They can show up often at the back of the heel or sometimes at the knee, for example. In most cases, these things aren't dangerous and certainly aren't going to make your arthritis necessarily worse or things like that. The other thing that can be a cause of different aches and pains are your biomechanics, or how the body and skeleton move. And in kids, this is of course changing. Every 6 months or a year, you know, they've got legs that are an inch longer and their body has to figure out how to move all over again. And sometimes it doesn't get it quite right. And so the movement patterns aren't as efficient as they would be normally otherwise. And that might cause muscles and joints to be a bit more sore or stiff or tight and so on. Of course, children with arthritis can have other reasons for altered biomechanics, either active flares or even past joint damage that might, as we talked about before, limit joint range of motion or strength of the muscles. And so this is another reason why it's so important to do the exercises that the physio tells you. And so I appreciated Mackenzie saying, listen to what your doctor says. I often am saying, listen to what your physio says. So I'm going to pass it back to Julia, who's going to talk a little bit about how we can help motivate and continue to support these kids.
Let's try that again. So we're on to make it interesting. Sorry, I forgot to unmute. So I've seen a couple of the questions come up, and so I'm going to try and touch a little bit on this. Number one, as Tommy mentioned and Mackenzie mentioned, it's really important to find something that makes you happy, that is enjoyable for you. And I've had a lot of kids come to me and say, I was told to swim and I hate swimming. I love swimming, Mackenzie loves swimming, which is great, but not everybody does, and that's totally fine. We need to find what lights your fire, what makes you excited, and then find a way to work with you to make that possible. Motivation, as Tommy mentioned, can be very challenging, and it can be a big hurdle to overcome. Certainly, I find that having a goal can be really helpful. So whether you are on a team that motivates you because your teammates are counting on you, or whether you do an individual sport or just are active because you need to move your body, having a goal can be really helpful. So something like, rather than saying, I'm going to try and run every day, say, you know what, in 2 weeks, I'd like to run a kilometer. Or, hey, I'm going to sign up for that 5K 3 months down the line. That can really help you keep what you want to do in sight and help get you moving every day. Sometimes it's just as simple as scheduling it into your day and just saying, every day at 5 o'clock, I go for a walk. And that sometimes is what people have to do to build some motivation and to develop that habit. I get told a lot that physio is really boring. So we apologize. We do try to make it entertaining as much as we can. So just a few ideas here. There's a million ways, and you really need to talk to your personal prescriber so that they can help find a way for your personal child. But for example, balance exercises. So if you are, while you're balancing, you're trying to throw socks into a laundry basket, or you're coloring, or you're playing on your iPad, or set up an obstacle course where you have to put different pillows and stuffies and books on the floor, and you're walking over them and trying not to fall over. So that's one example for younger kids. Sometimes for the really little kids, if I'm trying to get them to say move their foot, for example, I might put their stuffy on their leg and say, try to kiss your stuffy with your toes, and try to get a little bit of buy-in that way. Another idea that I sometimes have for some of my older kids is to kind of have like an exercise bank. So have, 3 balance exercises and 3 stretches, and every day you pick one from each column so that you're doing something different every day, just to kind of mix it up so that you're a bit more entertained. Having a buddy, if you're a teenager, they're doing their workout routine, you're doing your workout routine, you can kind of call each other up, or a family member that's willing to do it with you. Some of those things can help to be motivating. And certainly, I'm a parent, I am not above bribery. So sometimes, reward and can go a long way as well. Next slide, please. So of course, we've talked about these things, and we do recognize this is not as without its challenges, and that there are always challenges that come up. We just wanted to just briefly discuss the study that we found from Denmark, and it was a nice study looking at a group of kids with juvenile arthritis and asked them some questions about their activity. I wanted to first highlight why they said they wanted to be active, because I think it's important to always know what your why is. So they said they liked being with friends, they really liked the competition, they found that it helped them forget about their pain, and they just enjoyed the feeling of their body being in motion. So those were some of the reasons they enjoyed their activity. Some of the challenges they identified, the number one, we've heard this sort of throughout this presentation, is joint pain. They also talked about shortness of breath, which I would kind of link to deconditioning. A lack of competency. So this goes back to the idea of that physical literacy piece, where you just don't feel like you have the skills or you're at the level that you can play with your friends or compete with your friends. And then a lack of support from teachers and coaches they talked about as well. Some of the solutions they identified, and this was actually dealing primarily with the pain component, was, as Mackenzie mentioned, taking a couple breaks, sometimes modifying the activity, doing it a different way can work. And they also mentioned just sometimes they just push through the pain if they felt that they could do that. I wanted to touch on this support piece. So I've had some varying experiences. I've had some awesome coaches and teachers who've worked with our kids, and I've had some really negative experiences, unfortunately, with teachers in particular that said things like, you know, I have arthritis and I work through it, or kids don't get arthritis, so keep going. And that's a challenge. And I think, as Mackenzie highlighted, that it's probably a lack of education and understanding. And so I do try to work with my families. I'll send letters to coaches and teachers. I'll talk to coaches and teachers to help them try to understand and help support the student as best they can. And so I think it's important, if you're running up to this, that you do talk to your team and look for that support. A final thing that has come up for us is this idea of disclosure. This comes up with some of our higher elite level athletes, and the question of when to disclose. So we've had some kids tell us that they were concerned that if they disclosed they had arthritis, their coach in a tryout, that they would just get cut automatically and they wouldn't even be given a chance, or that people would judge them a different way. And so again, it's important to talk to your team about this. And also it's important, the disclosure piece is important from a safety perspective, but it also has to be done sort of maybe the right way or the right time. And so you need to work through that with your team. Next slide, please. We're getting into the home stretch here, guys. So finally, just briefly talking about physiotherapy, the continuum of physiotherapy. So every province and every hospital and every country, we have international guests, is going to vary with their access to physiotherapy. I'm very fortunate. I work in a tertiary care center, and I'm able to follow kids from the time of diagnosis or a flare right through till they're back to baseline or even exceeding their baseline. And I know that's not the same for everybody. Sometimes despite that, my hours aren't good or my location's not good. And so I do collaborate with outside physios or personal trainers to help continue kids' journeys. So I kind of put on my arthritis hat and I sort of give them that education, and then they can put on their sports hat and make sure the kids are getting what they need from that perspective. One example I have of this is I have a dancer right now who's a ballerina, and the next step of her dance journey is to get on point, and she has ankle arthritis. And so her point physio and myself have been communicating, and I've been kind of giving her information from the arthritis side, and she's been making sure that this girl is safe to, is strong enough and stable enough to be up on point. So we're working together to help support this girl's achievement. So I'm just going to briefly turn it back over to Tommy just to wrap up, and then we will be ready for questions.
Thanks, Julia. It's some really important wisdom and tips there. So I really appreciate hearing that from you again. I think bottom line from this talk really is that we all need to move more, and especially after a webinar like this, certainly for those who aren't on camera, if you're standing or sitting, please stand, and or after this webinar, please take a chance to move around. But I think it's what we're trying to highlight is that kids with JIA, they also have to move. Yeah, they will definitely have some limitations and challenges and fluctuations, good days and bad days that they have to face with, but they still have bodies and joints that were built to move. So I think it's important for healthcare providers and families to take the time to discuss physical activity with children who have JIA and other rheumatic disease. And as I said at the beginning, I'm convinced that together we can help children with rheumatic disease score higher than the general public in future report cards on physical activity. I think we should remember they can, they should, and they do. Let's all commit together to discuss physical activity with our children on a regular basis. Thank you very much.
Thank you so much, Tommy and Julia. And I'm going to invite Mackenzie to turn her camera back on now, and we're going to get started with our Q&A. I just wanted to say that we had an amazingly active chat conversation going on while your presentation was going. People were really engaged in the content. Someone gave a great suggestion about getting up during your presentation. I feel like all of our physical literacy just went up. in the last 25 minutes. And I just wanted to say to Mackenzie that we had just such a couple sweet messages come through our social media of some of the kids who were watching you present, and you know, that feeling of, hey, that's like me. And I think you know, that's an important piece that you highlighted as well in all of your presentations, is having that support network. And just wanting to let everyone know that Cassie and Friends is really thrilled to help provide some of that support network in a place where kids can see other kids just like them achieving amazing things. So we're going to get right into our questions. We have questions kind of coming in through a few different avenues. So I will maybe just call on you if the question is directed your way. And if you have anything to add, again, just feel free to jump on in. So one of the questions that we had right away were just kind of wanting to review high impact sports. So when kids aren't experiencing a flare, what are your general guidelines and suggestions around that? And maybe we'll start with Julia, and if Tommy wants to weigh in as well.
So I think Tommy sort of addressed this a little bit when he was talking about his example with the rugby player. So it's kind of two buckets. We know that high impact sports are going to be risky for everybody. And you could end up with a serious injury regardless of whether you have arthritis or not. So there's always going to be that risk attached to high impact sports. But if that's your passion and that's your joy, arthritis shouldn't be the limiting factor there. I believe there was a question at the end asking about the risk of injury and joint damage related to impact sports. And that sort of goes with this question that, you know, again, if you have a significant enough injury, it doesn't matter if you have baseline arthritis or not, there's going to be a risk down the road of having other outcomes from that. And so it's always weighing those risks and benefits, regardless of whether you have arthritis or not within the high impact sporting world.
Thanks, Julia. Yeah, I think to add to that, I would just say that you know, for the kids that we can get into remission, which these days fortunately is a lot of kids, not everybody, but a lot. I think we want to encourage them to do more or less whatever they would like to try to do. And in general, the benefits of being active and you know, even if that is by participating in a sport, are so important, and so important for sort of future health and mental health and those sorts of things, that we've really changed the conversation quite a bit over the last 15, 20 years or more. And I think we'll continue to, in terms of being a little bit more liberal in allowing kids who have arthritis, if they're in remission, to playing those higher impact sports as well.
I was just going to add, sorry, one other thing. Really, one thing I find in kids sports in general that's lacking is strength training. And if you are going to be playing in high level sport, no matter who you are, having a good strength program is really, really important, because that's going to decrease your risk and increase your ability to perform that sport. So whether it's a physio or a trainer, it's extra important to make sure that you have the strength to be able to withstand those sports as well.
And I think there was another question, it sort of relates to this in terms of cardio and strengthening and so on. I think that was one of the questions that was asked. You know, if the higher level and higher intensity of sport you play, I think the more important sort of proper warm-ups and cool downs are needed as well. You know, it goes for kids with arthritis or without, that we need to prepare our bodies to participate in these sports, and the more attention we pay to that, the better chance we have of avoiding sports injuries and things as such. And certainly with somebody who has arthritis, it's probably even more important to be diligent about those types of things.
Mm-hmm. Maybe we'll just stick on that topic, because the question was around that, but do you have any specific recommendations, maybe Julia, and actually Mackenzie, it'd be really interesting to know what your regime is, but for teenagers on like having a variety of strength training, cardio, and flexibility?
Yeah, so I think, as I just said, one of the biggest things that gets missed is strength training in kids. And I think that's because people don't really know how to do it, or if it's safe, or or they kind of just assume that they'll be fine and they just go for it. And I have a lot of people actually tell me like, oh, I don't need to do that exercise because I play soccer, so I'm already working out those muscles. And I'm like, well, maybe we could add a little to it. So for teenagers, so there's a little bit of variability with strength training throughout the spectrum of ages. And any age kid can do strength training. My kids that are 8 and younger have done strength training. It just shifts a little bit as we get older. So our general recommendation is for younger kids, we go with lighter or no weight or body weight and higher repetition. And as you get older and develop more of your testosterone comes in, we shift more towards being able to go with heavier weights and lower reps. So usually once you reach skeletal maturity, it's generally considered safe to be going with, some people may have heard of doing like 3 RMs or 1 RMs. We do not recommend that in kids before they're skeletally mature. Having said that, even if you are, say, a teenager and you are not totally skeletally mature yet, but you're enjoying weight training, you can still build up to very heavy weights. It's just a bit of a slower approach, and you always want to aim for that 3 sets of 10, 3 sets of 8 kind of range when you're working on building up. But you can still lift incredibly heavy weights despite that. So that's generally the recommendation. But it is important to have that balance of, you don't just want to do strength training either. You want to have a bit of the heart rate kind of activities as well as that strength training, and that those are really important to sort of marry together.
How have you worked those sort of activities into your own training, Mackenzie? And what experience did you have with them, as whether challenging or beneficial?
So with synchronized swimming, a lot of people think it's more like the flexibility side, but it's like you also need that strength. So I've been lucky enough. My dad is really into lifting weights and he knows a lot about it. So he's built me a program, and I get my strength from my dad, but I also get strength training from the synchronized swimming, because we also have dry land portions where we do like training with weights and stuff. And then my cardio, we always do we spend like an hour, because my practices are quite long sometimes. Like on Sundays, they're sometimes up to like 4 hours. So that's a lot to just do synchronized swimming. So sometimes we'll do like lap swimming, but like very fast for our cardio. And then I also will go for like those runs, or like go on the treadmill or the elliptical. And then for stretching, I stretch my splits, because that's what you do when you're a synchronized swimmer. And Julia is actually my physiotherapist, and we've had a conversation about how to stretch my splits with arthritis. So thank you, Julia. Yeah, and Julia's also giving me lots of exercises, and she's having me do those one-legged squats. And yeah, so I just try my hardest to make sure that I'm getting the weight training, like so the strength training, the cardio, and the stretching, and I'm getting a good mix of them, so that I'm not, because I find that if I do too much of one of them, I lose ability in the other. So if I do too much strength training, then I lose my flexibility. So I try to keep it balanced so that I don't train one side too much than the other, I guess.
Mackenzie, just sticking with you for a question. So obviously we have a lot of parents on the line with kids of all different ages. And in your presentation, you talked like so strongly about these hard conversations that you sometimes have to have, whether that be with coaches or just with a PE teacher or your primary teacher. And I wondered about how your parents supported you in that role, and when you maybe started taking on some of those conversations yourself, or when you ask your parents to support you, and what helps and what doesn't.
So my parents are very good. They're actually on here, so shout out to my parents. Yeah, so my mom really has helped set those with my coaches. She's really been, like, when I first started synchronized swimming, she set those boundaries with my coaches, and then I've just kind of reinforced them over the years. With gym teachers, I used to get her to either email them, or I would get a doctor's note and bring it in. But slowly, as I've like gotten older, because I've had arthritis before I started school, so it's been a long thing. I slowly started to do that stuff myself. So now it's not so much a conversation between me, my mom, and my gym teacher as much as it is me and just my gym teacher. And then if I need that extra reinforcement, then I'll ask my mom to send an email, or I'll get a doctor's note or something, or I'll get Julia to write me a letter. Yeah, so I just kind of have eased into doing it myself. And all kids are different. Some kids are more shy, some kids are more bold. So it's different for kids on when they feel comfortable. And it's, I think, all about that. It's if you feel comfortable having that conversation, and then if you don't, just get your parents to help you, or your doctor, or just anybody who's that supportive group in your life. Maybe have them help you have that tough conversation.
That's great. Thank you. Okay, so Dr. Gerschman, this next question is for you. And I think Mackenzie's touched on it, and we have it here coming in the sort of chat and the Q&A, and it's sometimes parents know, that their kids, like they know they should be active. They want them to achieve everything, but there's that little bit of a fear factor around what could happen, and is this going to make their disease worse? So the specific question being asked by a parent was, are sports injuries like medically likely to trigger a flare? And would a sport injury leave a joint more vulnerable to arthritis in the future?
Yeah, I mean, I think that the specific question about sports injuries and arthritis is a really important one. And I think that there are certainly times and cases where we've seen sports injuries trigger a flare. I think that can happen and does sometimes happen, but certainly not always. There are lots of times when kids are in remission and have a big sports injury and it does not trigger arthritis. So I think it could go either way. But I think if something happens, it's really about being aware and letting your pediatric rheumatology team know, so that they can perhaps keep a closer eye on things as well, because the approach and the treatment might just be slightly different if that does happen. If we could be entirely certain, of course, of things, then life would be so much easier, but that's not, of course, how it works. And so that's why I think we take a step back and first and foremost say that everybody has to move. And even kids with arthritis, as Julia said, even if you have some pain that's maybe ongoing for longer periods of time, you still need to try to find those 5 minutes in a day to move and build on that. I think what we want to do, though, is help kids find those things that they're passionate about and that is motivating in and of itself for them to participate in. And that can take a lot of trial and error, and it can take sort of being open and exploring different things. And that's why I think we had 30 kids in our sort of cohort of clinic back in Calgary. And I think out of those 30 kids, we had something like 18 different sports or something like that. It was pretty wide range of different sports that people were involved with. So I think, sometimes we need to think outside the box, or it's going for hikes or nature walks or bird watching or, something else as well. And so, I think that one other thing to touch on is, thinking about how do I prepare myself and prevent injury as much as possible. And that's something we talk about with all youth athletes, but maybe is even more important for kids with arthritis. I just want to highlight one of the areas where I find is a challenge is that as kids get older, of course, the intensity of the sport gets, more. The stakes are higher, the speed is faster, it's longer, it's more complex movements, complex, activities and things. So it takes a higher toll on the body. And this inflection point around puberty is a big challenge, because all of a sudden the body's gone through a growth spurt. And it doesn't necessarily, know how to move quite as smoothly and well. And so we often see a dip in coordination at that time. And probably that's a time where they're more susceptible, because again, the intensity is higher, but also the body sort of has to relearn how to move. So I would be particularly sort of mindful at that time to do your physio exercises and do your stretching and warm-ups and that sort of thing.
Also on the medical side, and I'll keep you up for a second, Tommy, was we had a really specific question about a high-level soccer player. She's 12 years old, has active uveitis as well as active uveitis as well as JIA. So the parent was asking about why the eye protection is required in terms of uveitis, and whether a blow to the eye or any kind of eye injury could increase or make her uveitis active again.
Yeah, I think it's something to be aware of. And certainly in some sports, eye protection, as I said, is sort of optional, and other places, there's different types of eye protection, and the rules, for example, in hockey, obviously over the years have changed from people being able to just wear visors to having to wear full cages. And so basically in those types of things, you want to go, as much as possible. I think in other sports, soccer, obviously you could, a soccer ball's bigger, so it's not going to necessarily, it's a little harder for it to hit the eye, but it still can happen and certainly hit around the eye. I think it's something to be aware of. And what I would say is that it's so important to play. And if your child's passionate about the sport, then of course they should play. There are things sometimes we can wear in terms of added eye protection, but it's important that that eye protection doesn't also reduce vision and awareness, because again, with the soccer ball, sometimes it's being able to do that header appropriately, and you're not blocked by some sort of device that's going to reduce your vision. But I think that if you do take a bad hit near the eye, it might be worth to make sure you think, when did I see my eye doctor? Am I overdue for that visit? And maybe we should check in, just to be aware of, because oftentimes the earlier we catch these things, the better chance we have of treating them. So I would just, I just want to raise that as an awareness, not to say stop playing soccer. Absolutely not. It's good to keep going with that.
Julia, come back on. So one of the things I think I've encountered, even just talking to families and youth, is that sort of feeling or frustration where the kid is giving their all in sports, but they feel that at the end of the day, their JIA is holding them back in a way that it, might not be for their peers. And that just seems to be that sort of limiting factor or hurdle they can't get past. And I wonder just how you provide, guidance or reassurance, or what kind of advice you provide in that case to both parents and kids who might be frustrated by that.
I saw that question come up and I think it broke my heart a little bit. You know what, that's a hard question. And, I think the thing is that we should be doing activity in sport for the love of the activity in sport. I think as our society in general has gotten caught up with the idea that we have to be competitive and we all have to be Olympic athletes. And it's a really unfortunate situation to be in. And I'm finding that younger and younger kids are training at ridiculous numbers of hours to try and compete at these ridiculous levels. I'm seeing so many kids burnt out and with overuse injuries, and it's a really big problem. I'm an elite level athlete and I've never seen anything like this before. But my kids are not. And I've really tried hard again to instill that activity for life in my kids and finding something that they enjoy. So we just dabble in sport. Like we try a variety of different things. And if they became super excited about something, then absolutely I'd support them in that. But really, I'm just trying to give them a lot of exposure to a lot of different things. In a situation like that, where you have a kid that's really passionate about an activity, but just isn't able to compete at, the next level, I think it's important to really take a step back and say, why do I do this? Am I doing this because I want to be the best in the world? Or am I doing this because it makes me feel good and I have friends and I love it? And try to reframe that and really do it for the right reasons. There's also a lot of ways. Now, this is also where it gets a bit tricky, because sometimes your peer group is part of that sport. But sometimes there's a non-competitive stream and a competitive stream. And, sometimes you have to jump ship and switch. And of course, it's difficult to say that because of your arthritis. It certainly happens for people outside of arthritis as well. And sometimes, the life of your sport is, ends or changes, and you have to sort of consolidate that. and learn to be okay with it, or kind of, again, reevaluate, and then, maybe shift to a different gear and see if you can still find the joy and love of that. And maybe if you can't anymore, you try something different. But yeah, that did make me very sad. I'm hoping that that person just loves being active and loves the sport, and can take a step back from the competitiveness of it and just enjoy it for what it is.
Mackenzie, have you ever had a day like that, or a competition where you were just, maybe for a bad lack of a better word, mad? Or feeling like this isn't fair?
So at competitions, I'm usually, especially around competitions, I'm really good about taking my medicines and I'm getting ready for that competition because I know that it could happen, but luckily for me, it hasn't happened yet. But there's definitely been practices where I'm sitting on the wall sometimes with like my legs out straight when all the other girls are practicing, that I'm just like, oh, I wish I could be in the pool right now. But then I have to think and I have to say, well, no, because if you get in the pool right now, there's a high chance it will get worse. And a couple years back, I went to arthritis camp, which was like a camp where I got to meet a whole bunch of kids around my age that also have arthritis, and I got to like get some close friends there. And one of the girls that I was like in a room with, she was telling me that she really loved a sport, but then she couldn't do it anymore. And then she found, I can't remember the sports, but then she found a new sport, and then she fell even more in love with it. And it was a sport that was easier on her joints. So I think that's important that you also, like for me, swimming is so important. And luckily, it's not so hard on the joints. But I think it's also important that you love other sports as well. And again, it doesn't have to be sports. It could be you love spending time running with your dog, or you love playing with your siblings on a trampoline or whatever. So, yeah.
I think, again, yeah, just keeping that positive outlook and being flexible. And I know that, we've shared some research in one of our newsletters about how just the family getting engaged with it can also help for younger kids as well, to find something fun to do together, and really not to see sort of what you can't do, but like you, Mackenzie, just focus on what you can do. So I think that we have run out of time for questions. So with that, I really just want to thank Julia, Dr. Gerschman, and Mackenzie as well for your amazing presentations. If we did not get to your question, I just want to let everyone know that we will be uploading the recording of this webinar to our resource section of our website, and we will do our best actually to offline answer any of the questions that didn't get specifically addressed, and we'll send out an email when that happens. So thank you again to everyone who joined us on this Saturday evening for our physical activity and education webinar. This was just amazing and full of so much great information. Thank you, guys.
Thanks, everybody.
Thank you.
As they depart, we're just going to jump back to our slides for 1 second, and we're going to wrap up the webinar just with a few reminders of what's to come. So right after this event, actually it should be in your inbox right now, we are going to be sending out a survey, and we really appreciate if you take the time to fill that survey out and let us know what you thought, what was useful, what we could do better, and especially if you have ideas for topics that you'd like us to cover. We have a pretty full calendar of webinars planned through 2021, and again, just really want to make sure that we're providing the information that's important to you as families and healthcare providers. And then just a quick reminder, we have next up registrations already open for our nutrition webinar at the end of February, and a Methotrexate webinar at the end of March. Next slide. Yes, and just a reminder, I saw actually some activity happening in our online support network. So we have parents there, a great time. You can access it anytime, actually. But that support network is there for you always, and it's a great place where parents can, in a private and secure place, connect with other parents, as well as some really great resources. Next slide. One more thank you to our series sponsors. Their financial contributions are so important to making this webinar series happen, as well as many of the activities at Cassie and Friends. So thank you to Nicola Wealth, Avi, Amgen, Roche, and Sobi. And next slide. As well, we have many, many families, friends who participate and get involved, volunteer, as well as donate to Cassie and Friends in all kinds of different ways. If you enjoyed the session today and are finding these valuable, we always appreciate your support. And another great way to get involved, I just want to remind everyone, is to join Team Cassie and Friends, which will be launching soon right across Canada through the virtual platform. And we talked a lot about awareness today, and that's a really excellent way to leverage the run as a way to start talking and have a conversation with family members, friends, teachers, etc., to educate them about what juvenile arthritis and other rheumatic diseases mean to kids, how they can impact them at school and in sport, and really just make sure that you know, the general community knows that kids also get arthritis, and that this community is unstoppable. Next slide, please. Lastly, and just to close off, our website is cassieandfriends.ca. If you want to get in touch with us, our email is info@cassieandfriends.ca. And again, we encourage you to join our support network. So thank you very much to everyone, and I hope you have a great rest of your weekend. Bye.